My name is Dr. Rodriguez. I am a weight loss doctor in weightrx.org. Did you know that semaglutide, a glucagon-like peptide-1, GLP-1 receptor agonist, has gained substantial attention in recent years due to its effectiveness in treating obesity? The regulatory approval process for semaglutide as a weight loss treatment highlights its efficacy, safety, and importance as a therapeutic option for individuals struggling with excess body weight. Understanding the regulatory landscape and guidelines governing its use is essential for healthcare providers and patients. In June 2021, the U.S. Food and Drug Administration (FDA) approved semaglutide 2.4 milligrams, marketed under the brand name Wegovy, as a weight management treatment for adults with obesity or those overweight with weight-related comorbidities. This approval followed the results of several clinical trials demonstrating the drug's efficacy in promoting significant weight loss in participants with a body mass index, BMI, of 30 or higher, or those with a BMI of 27 or higher with at least one weight-related condition such as hypertension or type 2 diabetes. Following the FDA's approval, the European Medicines Agency, EMA, also granted marketing authorization for semaglutide 2.4 milligrams for weight management under the brand name Wegovy. The EMA's decision, issued in early 2022, was similarly based on robust clinical trial data demonstrating the drug's ability to help individuals achieve and maintain significant weight loss. The EMA approved semaglutide for use in adults with obesity, BMI greater than or equal to 30, or those overweight, BMI greater than or equal to 27, with at least one weight-related comorbidity. In Europe, the guidelines emphasize the importance of combining semaglutide with a reduced calorie diet and increased physical activity for optimal results. The approval also highlights semaglutide's dual role in addressing weight-related health conditions such as cardiovascular disease and type 2 diabetes. The World Health Organization, WHO, has recognized obesity as a global health crisis, urging governments and healthcare providers to prioritize interventions that address this growing epidemic. While the WHO does not issue drug-specific approvals, its guidelines for the treatment of obesity emphasize the importance of medically supervised interventions, particularly for individuals with obesity-related comorbidities. Semaglutide's approval by regulatory agencies aligns with the WHO's broader recommendations to offer pharmacological treatments when lifestyle modifications alone are insufficient. Several professional organizations, including the American Diabetes Association, ADA, and the Obesity Society, have updated their clinical guidelines to include semaglutide as a recommended treatment option for weight management. These guidelines provide healthcare providers with evidence-based recommendations on how to incorporate semaglutide into a comprehensive obesity treatment plan. Patient eligibility. According to guidelines, semaglutide is recommended for adults with a BMI of 30 or higher, or those with a BMI of 27 or higher and at least one obesity-related comorbidity. It is not intended for individuals with a normal BMI or those seeking weight loss for cosmetic reasons. Dosing and administration. Semaglutide is administered as a once-weekly subcutaneous injection. The dose is gradually increased over several weeks to minimize potential side effects, such as nausea. Patients typically start with a lower dose and gradually increase to the full 2.4 milligrams dose. Lifestyle modifications. Both the FDA and EMA emphasize that semaglutide should be used in conjunction with a reduced calorie diet and increased physical activity. Clinical guidelines reiterate the importance of lifestyle modifications to enhance the drug's efficacy and help patients achieve sustained weight loss. Monitoring and follow-up. Patients using semaglutide for weight management should be closely monitored by healthcare providers. Guidelines suggest regular follow-up appointments to assess weight loss progress, potential side effects, and overall health improvements. Monitoring is also essential to ensure patients maintain a healthy weight and prevent weight regain after discontinuing treatment. Duration of treatment. Semaglutide is considered a long-term treatment option for obesity. Clinical guidelines recommend continued use of the medication as long as the patient is experiencing benefits and tolerating the drug well.
For more information on this topic, please subscribe to our channel or text our clinic number. Brought to you by weightrx.org.